Hi guys, it's your next nurse Florence and you're welcome once again to my channel. In today's video, we're going to be talking about peptic ulcer disease. Here we'll talk about the definition, the types, the causes, the risk factors, the prevention, the diagnosis, the complications, and the treatment. Stick with me. To my subscribers, you guys are the real MVPs because you're always coming back and you'll be sticking with me all through this journey. I love you guys so much. And if this is your first time of visiting my channel or you visited my channel before and haven't subscribed, please consider subscribing. On this channel, we talk about emergency health and wellness tips that I know will be beneficial to you and to your family. Thank you. The word peptic means that the cause of the problem is an acid. Ulcers occur when the stomach acid damages the lining of the digestive tract. Peptic ulcer is a sore or a wound that develops in the esophagus, the stomach, or the lining of the small intestine, and it's also called stomach ulcer. The most common causes of peptic ulcers are an infection with bacterium Helicobacter pylori, also called H. pylori, and long-term use of non-steroidal anti-inflammatory drugs. Peptic ulcers can also occur when the acid in the digestive tract eats away at the inner surface of the stomach or the small intestine. The acid can create a painful open sore that may bleed. Normally, the digestive tract is coated with mucus layer that protects against acids. But if the amount of mucus is decreased or the amount of the acid is increased, you could develop an ulcer. Another cause of peptic ulcers is the use of other medications along with non-steroidal anti-inflammatory drugs or the NSAIDs like steroids, anticoagulants, selective serotonin reuptake inhibitors, that's the SSRIs, or low-dose aspirin. These drugs greatly increase the chances of developing peptic ulcers. You may have increased risk of peptic ulcers if you 1. Drink alcohol. Alcohol can irritate and erode the mucous lining in your stomach and increase the amount of stomach acid that is produced. 2. Smoking. Smoking can increase the risk of people who are infected with H. pylori. 3. Having untreated stress. 4. Eating spicy foods. Note that stress and spicy foods do not cause peptic ulcers. However, they can make your symptoms worse. The two most common types of peptic ulcers are the gastric ulcers and the duodenal ulcers. These names refers to the location where the ulcer is found. Gastric ulcers are located in the stomach, while duodenal ulcers are found at the beginning of the small intestine, also known as the duodenum. A person may have both gastric ulcers and duodenal ulcers at the same time. In my next video, I'm going to be talking about the duodenal ulcers and the gastric ulcers, the difference. I'm going to talk about them in details. Please do well to watch it. The most typical way for ulcers to be diagnosed is by a procedure called esophagogastroduodenoscopy. Tongue twisting, right? Just call it EGD or upper endoscopy. Other ways include upper GI series, that's upper gastrointestinal series, also called barium swallow. This is the use of x-rays to look at the lining of the stomach. Laboratory tests of H. pylori with the use of blood, stool, or breath tests. The breath test is the most accurate. The most common peptic ulcer symptom is burning stomach pain. Many people with peptic ulcers do not have symptoms. Less often, ulcers may cause severe signs and symptoms such as vomiting or vomiting blood, which may appear red or dark blood in stools or stools that are black or tarry, heartburn, feeling of fullness, bloating or belching or intolerance to fatty foods, nausea or vomiting, feeling faint, trouble breathing, unexplained weight loss, and appetite changes. If left untreated, peptic ulcers can result in internal bleeding, obstruction, gastric cancer, a hole or perforation in the stomach wall, which can put you at risk of serious infection of your abdominal cavity. That's also called peritonitis. If you have serious complication, you may require surgery. However, surgery is needed far less often now because of many effective medications available. So how do you prevent peptic ulcer disease? You can prevent or reduce your risk of peptic ulcers disease if you 1. Protect yourself from infections. H. pylori could be transmitted from person to person through food or water. So you should take steps to protect yourself by washing your hands frequently with soap and water, eating foods that are cooked completely, and drinking clean water. 2. Do not smoke or avoid smoking. 3. Avoid taking medications with alcohol or avoid alcohol when you're taking your medication. Use caution when taking pain relievers, especially NSAIDs. Take them with meals. If you must take an NSAID, you may need to take an antacid, a proton pump inhibitor, an acid blocker, or a cytoprotective agent. All these will be determined by your HCP, as your healthcare provider. So if you have any symptoms, please go to the hospital. 4. Use caution when taking pain relievers, especially NSAIDs. 5. Control stress or learn to cope with it by spending time with friends, doing exercises, or writing in a journal. Treatment of peptic ulcers depends on the cause. For H. pylori bacterium, antibiotics can be recommended to kill the bacteria. Medications that block acid production and promote healing can be used. One example is the proton pump inhibitors. Other medications are medications to reduce acid production. An example of that is the acid blocker or antacids. Antacids neutralizes stomach acids. Another medication that can be used to treat peptic ulcers is that which protects the lining of your stomach and your small intestine. Example of this medication is the cytoprotective agents. So guys, we've come to the end of this video, and I'm sure you've learned a thing or two about peptic ulcer disease and how to manage it. If you find this content helpful and useful, please give me a thumbs up by clicking on the like button. Please subscribe to my channel for free by clicking on the red subscribe button. Also, click on the notification bell so you'll be the first to know when I upload new videos. You can drop your comments in the comment section below, or your questions or concerns, and I will attend to them. I'm still your next nurse, and I'm just a I love you guys.